Hello, and welcome to the 2018 Open Enrollment presentation for retirees. I am Melanie Denning with the Healthcare and Benefits Division. For retirees, you should have already received a postcard detailing the detailed locations and times of the live presentations, the webinar, and the access for pre-recorded presentation. The Open Enrollment booklet, which included your retiree election form, was mailed last week. If you do not already have received this booklet and election form, you should very soon. If you do not receive a booklet and election form, you should contact Healthcare and Benefits to request another copy. Live sessions will be held across the state, including Anaconda, Billings, Bozeman, Butte, Deer Lodge, Great Falls, Kalispell, Lewistown, Miles City, Missoula, and Polson. There will also be 2 sessions held in Helena. Healthcare and Benefits will also host a webinar on Monday, October 16, 2017 at 2 p.m. for any retirees that would like to sign in and attend. You may find information on the website at benefits.mt.gov/open enrollment. Retirees who wish to make any changes to their state of Montana benefit plan should return their open enrollment election form by November 3rd. The State of Montana Benefit Plan, or State Plan, is self-funded. The State Plan is funded by monthly employer contributions and employee and retiree contributions. Those contributions are held by the State Plan and used to pay State Plan expenses, the vast majority of which are claims. As noted by our Department of Administration Director, John Lewis, in the Open Enrollment booklet being mailed to all State of Montana employees and retirees, he congratulates employees and retirees for doing a great job of managing their medically related costs. Medical expenses, or trend, for 2016 were actually down some, coming in at $137 million. Prescription expenses rose only $2 million to a total of $32 million, and the dental-related expenses remained stable at $8 million. When you balance our income with our expenses, you get the State Plan reserve. State Plan reserves are needed because we can't control all the variables surrounding operating a state plan. We are able to control many of our plan costs, but there are some things we don't have direct control over, including our largest income source, the employer contribution. The employer contribution is set by the legislature every 2 years. Healthcare and Benefits works hard to provide funding recommendations, but ultimately has to comply with the funding set by the legislature. Federal mandates also directly impact the state plan expenses. And for example, this year, the state plan has been required to cover statins, which are cholesterol-lowering medications, at a $0 copay due to the Affordable Health Care Act, or ACA. Medical trend, the increasing cost of medical care, is a huge variable to the state plan and has little control over. The cost of medical procedures and prescription medications continues to rise year after year. And finally, Healthcare and Benefits works hard to establish and estimate to evaluate the expenses that we have on a general idea of the volume of claims in a given year. But there can be surprises. For example, one year we might not see any claims for premature infants, and then the next year we may see 5, resulting in millions of dollars of claims. The state plan needs to always have enough money in reserves to cover all 30,000 plus members when they need us. State plan rates for the medical, prescription, and dental and vision are not changing for 2018. This means contributions will stay the same for 2018, and we're very pleased to be sharing this good news with you. The state plan rates have been updated on the HCBD website at benefits.mt.gov, and they're also available to you in the Open Enrollment booklet. Your 2018 Open Enrollment booklet has detailed information regarding the retiree plan rates. Additionally, your election form indicates your anticipated costs for 2018. You should be aware that once you become Medicare eligible, you must enroll in Medicare Parts A and B, and you will be automatically enrolled in the State Plan D coverage. you cannot sign up for any other Part D coverage. If you do, you will not be allowed to stay on the state of Montana plan benefits. Healthcare and benefits will require proof of your Medicare enrollment, and you will be automatically charged the Medicare retiree rate. Your monthly rate is reduced when you become Medicare eligible because the state plan becomes secondary coverage to Medicare. In addition to no rate increases for retiree monthly contributions, there will also be no changes to the medical plan out-of-pocket costs. This means medical plan copays, deductibles, and maximum out-of-pocket costs will stay the same for 2018. You can refer to the open enrollment booklet, the HCBD website, or the WRAP plan document for any additional state plan coverage information. Benefit changes for retirees. Applied behavioral analysis, or ABA treatment, the state of Montana has adopted a licensing process for ABA therapists. Effective April 1st of 2018, the state plan will only pay ABA claims submitted by a licensed ABA therapist. Next, cholesterol medications, or statins. Effective January 1st of 2018, the Affordable Care Act has required cholesterol medications like Lipitor or similar equivalents to be covered as a preventive treatment at no member copay. The Navitas formulary will apply, and additional questions should be directed to Navitas Health Solutions at 866-333-2757 or the Navitas website at www.navitas.com. Diabetic test strips, effective January 1st, will apply a Tier 2 or $50 copay under the Navitas prescription drug program. The Navitas formulary will apply, and additional questions should again be directed to the Navitas Health Solutions at the toll-free number or the website navitas.com. Last, the non-ambulance travel benefit. This benefit was added to the state plan effective July 1st of 2016 as a way to assist members who may need to travel to non-participating facilities or hospitals for services. Effective January 1st of 2018, the non-ambulance benefit is being removed from the state plan due to the fact that all facilities or hospitals within the state of Montana are participating with the state plan. Specialty Drug Company. Effective January 1st, 2018, the Tier 4 or $200 copay for specialty drugs filled at a preferred specialty pharmacy will be $50 versus $200 for retirees who are over the age of 65 and enrolled in the Navitas Medicare RX or prescription drug program with the state of Montana. All other retirees will continue to have Tier 4 or $200 copay applied, but they will have access to the manufacturer couponing programs as well. During open enrollment period, retirees can make changes to coverage like enrolling or waiving the state plan. You can also add or delete dependents from the plan. And this is the time to elect or re-elect the Vision Hardware plan. The Vision Hardware plan will be terminated effective January 1st, 2018 if you do not complete and return the retiree election form. If you as a retiree don't do anything and don't return in your election form, you will have the same medical and dental coverage that you have right now for the entire 2018 plan year unless you or a dependent qualify for a special enrollment period. See the WRAP plan document for details. Again, be aware, the Vision Hardware plan will be terminated effective January 1st if you do not complete and return the retiree election form. It is not necessary to return the 2018 open enrollment election form. However, if you do not complete and return the 2018 open enrollment election form, you will have the same medical, dental, and life coverage for yourself, your spouse and domestic partner, or dependents in 2018 as you elected in 2017. You won't be enrolled in the Vision Hardware plan unless you complete and return that open enrollment election form. Forms must be returned or postmarked to the Healthcare and Benefits Division by November 3rd, 2017. Forms can be returned in person to the HCBD office in Helena, or you may mail, fax, or email as noted on this slide. You should be receiving or may have already received your Retiree Open Enrollment Booklet and election form in the mail. The Open Enrollment Booklet contains important information about the 2018 rates and plan year. We will walk through the Retiree Open Enrollment election form in the next few slides. The first thing we want you to do with the Retiree Open Election Form is to check your contact information. If there is any information that is not correct, be sure to note the correction and return the form to Healthcare and Benefits or give Healthcare and Benefits a call. Remember, if you're a snowbird, we need to have the best address to get your information to you in a timely manner. So call Healthcare and Benefits before you leave and let us know when you come back. Additionally, Healthcare and Benefits would love to be able to communicate information with you via email. So if you have an email address, please add it to the election form and return it to us. The next section of the election form is an overview of your current benefits. This section shows what you have now, your current benefit payment, and what your expected contribution amount will be for 2018 if you don't make any benefit elections in 2018. Your Live Life Well incentive is current through September 1st. Please be aware this amount is not your final incentive earned if you've already completed a Live Life Well activity or self-reported next steps in the MyActive Health portal. You should refer to the MyActive Health portal, www.myactivehealth.com/SOM, for the most current information regarding your incentive status. Since the Live Life Well incentive program does not end until October 31st, 2017, the final incentive cannot be loaded into the Sabre system until after that date. Your final confirmation statement you receive in December will reflect your final incentive earned. The next section outlines your 2018 coverage election status. The individuals and coverages listed in this section are a reflection of what your current coverage is. This year, during the open enrollment period, you have the option of adding a spouse or domestic partner or child or children under the age of 26 to the state plan. You only need to complete this section if you want to change to you or your dependent coverages. Be sure to turn in the election form, as there is important information on the back that requires your action. Vision hardware coverage. If you want to enroll or continue your previous enrollment on the Vision hardware plan, you must check the Yes box and return your election form. This benefit is not rolled over automatically to the next year's enrollment. Your Vision hardware plan will be terminated effective January 1st, 2018 if you fail to return the election form. The next section only needs to be completed if you would like to terminate the state plan. On the next slide, we'll talk more about reasons why you might want to terminate your state plan coverage. Although your open enrollment benefit elections must be returned or postmarked by November 3rd, you will have until December 31st to elect to terminate the state plan coverage. You should be aware that if you elect to terminate your state plan coverage, you will not have an opportunity to re-enroll in the future. As a retiree, you may have the option to stay on the state plan, but you may have other options that may be more financially beneficial for you than staying on the state plan. This includes the health insurance marketplace at www.healthcare.gov if you're under 65, and Medicare supplements or Advantage plans if you're over 65. For more information on those, please contact a state health insurance program or SHIP representative in your area by calling 800-551-3191. However, you should be aware that if you terminate state plan coverage, you will not be able to re-enroll at a future date. And finally, there is a signature line on the form. If you are making any changes, including any updates to your contact information or providing an email address for communications, you must sign, date, and return the form to Healthcare and Benefits. It is not necessary to return the 2018 open enrollment election form. However, If you do not complete and return the 2018 open enrollment election form, you will have the same medical, dental, and life coverage for yourself, spouse, domestic partner, and dependents in 2018 as you elected for 2017. And you will not be enrolled in the Vision Hardware Plan unless you complete and return the 2018 open election enrollment form. Forms must be returned or postmarked to Healthcare and Benefits Division by November 3rd. And again, forms can be returned in person to the Healthcare and Benefits Office in Helena or via mail, fax, or email. On the election form, below your signature, you will find an outline of what is required to be provided for proof of eligibility if you're adding a spouse or domestic partner or children. If you add a spouse or domestic partner or child or children to your plan, you must submit the appropriate verification of eligibility documentation to Healthcare and Benefits by December 15th, 2017. Healthcare and Benefits will not send you a reminder about this, and information about verification of eligibility can also be found on our website at www.benefits.mt.gov/open enrollment. If you fail to provide the appropriate dependent verification documentation on any dependent you enroll during open enrollment period, they will not be added to your state plan coverage effective January 1st, 2018. 2018 retiree confirmation statements will be mailed to the retirees in December. Watch your mailbox. Review them carefully and contact Healthcare and Benefits immediately if you find a discrepancy. For retirees that self-pay, coupon books will also be mailed out in late December of 2018. This year's Live Life Well incentive deadline is October 31st, 2017. Don't miss out. Hopefully you've already had a state-sponsored health screening. Remember, you must complete a state-sponsored health screening to receive any of the incentive. That's $5 a month off your 2018 benefit payment. We've added extra screening opportunities at the Montana Health Center locations for October, but we can't guarantee that you can get in if you've waited. If you complete a state-sponsored health screening, you were tested for nicotine in that health screening. And if you are nicotine-free, that's another $10 a month off. If you are not nicotine-free and still wish to earn the incentive, you must complete and self-report a completed alternative activity. Lastly, you must self-report your next step activity to receive the remaining $15 for a potential total of $30 a month reduction in 2018. If you want to earn the $15 next step incentive, you must also report your activity in the My Active Health site. Even if you did a wellness challenge like the Governor's Stay Active Challenge, you have to report it. If you are also not nicotine-free but did an alternative like a nicotine cessation program, you have to self-report that activity as well. Simply log in to www.myactivehealth.com portal and click the My Rewards tab on the left. Then click the Result or Work on It under the Next Step Incentive tab. In order to get credit for any next step activity, you must report you completed the activity in the My Active Health portal. You must report all activities, including the Governor's Stay Active Challenge. Once you report the activity and it's completed, it says Complete in the portal. You should say Completed in the comments column. It can take a day or two for the system to update your incentive progress once you self-report your activity. If you report a next step activity, but your state-sponsored health screening has not been reported to My Active Health yet, your portal will save your self-reported information, but it won't show any incentive progress until the state-sponsored health screening gets reported. If you do not have internet access and need to self-report the next step activity, please contact Healthcare and Benefits prior to October 31st for the appropriate form. There are changes ahead for the 2018 Live Life Well incentive program. You can still earn $30 a month off for your 2019 benefit contributions, and you may double your incentive if a covered spouse or domestic partner also participates. But you must complete all 3 activities, health screening, being nicotine-free or self-reporting an alternative, and self-report a next step activity between November 1st, 2017 and October 31st of 2018 to earn any of the incentives. For 2018, nicotine testing will no longer be done via the health screening. You must self-report this activity for 2018 in the MyActive Health portal. This change has been made because the state of Montana plan did not see a large increase in the number of positive test results during the years nicotine testing was completed via the health screening versus the number of self-reports completed in previous years. Additionally, similar to other state agencies, the Department of Administration has tasked HCBD with implementing cost-saving solution, and this change results in a significant state plan savings without reducing benefits. You will keep track of your 2018 Live Life Well incentive and self-report your activities, including nicotine use, in the MyActive Health portal. If there is a medical reason that you can't do any parts of the Live Life Well incentive, there are exceptions and alternatives available. Call Healthcare and Benefits to learn more. Important state plan reminders. Air ambulance transport. The Montana legislature passed Senate Bill 44, which pertains to emergent flights provided by non-participating air ambulance transport companies that are not controlled by Montana Hospital. The bill requires that the state plan make payment based on billed charges or negotiated amount or the participating provider contracted amount. The state plan pays at 250% of Medicare. That's a participating provider amount. In this case, a member is held harmless except for their deductible, etc. There are still circumstances where a member may be balanced billed. Contact Allegiance at 855-999-1057 with any questions. Participating providers. Participating providers and facilities have contracted with Allegiance in Montana and Cigna outside of Montana to accept a low, fair rate for your care. Check if your provider and or facility you are participating before you go. Visit www.askallegiance.com/State of Montana or 855-999-1057. Retail pharmacy fill. Remember, you may receive up to a 90-day supply of medication from your participating retail pharmacy for 2 copays. This is also the case for participating mail-order pharmacies. Other reminders include Medicare enrollment. As of January 1st, 2017, if a retiree or a retiree's spouse or domestic partner becomes Medicare eligible, the retiree or the retiree's spouse or domestic partner must enroll in both Medicare Part A and B as of the first of the month of eligibility. Proof of Medicare enrollment in Parts A and B will be required by Healthcare and Benefits. Enrollment in any Medicare Part D drug plan besides the Navitas Medicare RX prescription drug plan is not permitted and would result in termination of all state plan benefits. Retreat rights. Remember, as of January 1st, 2017, the state plan eliminated retreat rights, so that if you elect to terminate your state plan coverage, you will not have an opportunity to re-enroll. And last, survivor benefits. Please be aware, surviving spouse and dependent children of retirees that pass away may only remain covered by the state plan until the spouse or dependent is eligible for Medicare or another group health plan. During and after open enrollment, watch your mail and email for some other important documents coming from Healthcare and Benefits Division. Those include your 2008 WRAP Plan Document, or WPD, formerly referred to as the Summary Plan Document, or SPD. That's a big booklet that outlines everything that's covered on and all the state plan details. You'll receive a summary of benefit coverage, which is a legal document required by the Affordable Care Act. It's a short summary of our plan. You'll also receive a Medicare Part D creditable coverage letter and a few other legal notices. Also, check our website frequently for updates. We will be posting health screening and flu shot schedules, incentive information, and great training videos to help you learn more about how to make the most of your benefits. Call or email us with questions. We do want to hear from you. Thank you for your attendance, and as always, if you have any questions, call Healthcare and Benefits.